My name is Dalton Shaw, CEO of OmniLife, and we are building life-saving connections that eliminate human organ and tissue waste, lower cost, and save lives. So we have a platform that's connecting and servicing the entire allo transplant market. This includes organ, tissue, and actually also cell. Our connected purpose to this industry begins with a personal story for both founders. I myself played football at University of Iowa 60 pounds ago and ended up with having a motorcycle accident that resulted in a myriad of injuries, one of which was a paralyzed right arm. And I had a paralyzed right arm for about a year and ended up having a nerve transplant, which has given me full restoration of my arm. That was the really inception for me that tissue, donated tissue from a deceased donor, could be repurposed to change somebody's life that needed one. So that was the inception for my research. I started doing research at the University of Iowa, and that's when I ran into Eric Paul, PhD, health informaticist. He was doing his thesis on organ allocation, improving liver and kidney allocation. We were mentioned Forbes 30 under 30 promising healthcare startups in 2018. One of the numbers that Eric's research uncovered was a 54% waste rate with donated solid organs. This includes kidney, liver, lungs, pancreas, intestine. And what we obviously were shocked by that number and started looking into for reasons why, and that was really the inception of our business. Every single year, 22 people, or every single day, 22 people die waiting for a life-saving transplant. And actually, when you think about organ transplant or tissue transplant or replacement as a treatment, there's over approximately one third of deaths due to chronic disease, such as diabetes, heart disease, heart failure, could be prevented by organ replacement if we had more supply. So our solution is really simple. We connect this highly complicated, fragmented industry with our two-sided marketplace platform. We then build automated workflows that includes documentation and automated communication and automated documentation that allows us to save a lot of time for frontline staff. And then we use and leverage the data on our platform to improve workflows, processes, and streamline the supply chain of human organs and tissues to reduce cost and increase safety. The industry itself is highly complex, but I think a simple parallel that we like to draw to give you an idea of the interface of our application and how it's being used without needing to understand the complexity of this entire industry is the Domino's pizza tracker. So you can track the time from your time your pizza goes in the oven till it's at your doorstep and know the physical location of your pizza at all time. Yet an organ with a heart transplant that on average goes for about $1.2 million. You have no idea where it's at. It's being carried in an igloo container. So what we've done is there's around 30 constituents that are highly critical that participate in updating information during the course of a 72-hour process from the time that the donor arrives at the hospital to the time the organs are leaving the body and going to the recipient. And what we've created is we work with each of those different constituents, create workflows custom to their organization, and then bring everybody together on a connected network, and then allow people to update this either manually as they complete these different steps, and or in some cases automatically when the organ is actually moving physical locations if they work with some of our partners that integrate their tools and services to allow real-time tracking capabilities of the organ. So we've essentially digitized the supply chain and then wrapped communication around everything to keep everybody on the same page. We released this application in 2018 as part of an NIH SBR phase 1 study that showed a 35% increase in organs transplanted and significantly increased the efficiency and the quality of life for frontline staff, which is really, really important to make sure the providers using the tool see benefit from it personally. This study has since expanded into a $1.5 million phase 2 grant from the National Institute of Health that include 10 transplant centers. We've now grown over to 20 hospitals that are collaborating on our network, and we've facilitated over 1,000 life-saving transplants. We have a tremendous experience in both business and in the industry on our advisory board. Manny Villafana, which was one of our first investors, was the founder of St. Jude Medical, which got acquired by Abbott for 25 billion. And he had 7 successful IPOs. Dr. Hippen and Angie Corson are both longtime experts in this industry, in different areas of the supply chain or different areas of this care management process, particularly within kidney disease, which is an area that is a focus for us. And then Paul Winandy, who's a board member and grew WebPT from 1 to 40 million with a very lucrative exit. We've raised about 1.5 or $2.5 million to date, $5 million in total if you include non-dilutive. So we've done almost a 1-to-1 match of private dollars to non-dilutive dollars through grants. Here's a list of our growing investor syndicate. Our latest round is a $1 million round. We've raised 750,000 of that in 2020. And we've actually launched a side-by-side strategy with utilizing the Wonder Fund platform to raise the remaining and accelerate the close of the 250,000. And you can certainly make contributions at our Wonder Fund page link, or you can also become a deal sponsor. And if you have any questions on what that means or how you can help us continue to grow and be an advocate of our social impact and our mission, please email me and I'll take questions.
Looks like there is a question. Oh, maybe not. I do have a question here, Dalton. Can you tell us a little bit about what your revenues have looked like over the last year to 2 years?
Yeah, so in 2018 and 19, that was a commercial product that was beta revenue. So I think we ended the year in 2019 with something like 48,000 ARR. In 2020, we ended the year with just over 200,000 ARR, and we hope to scale to hit that 1 million ARR goal this year.
Okay. And what's the churn look like right now?
Churn so far, I'd have to give you. I can say that we've only had lost one account over the course of the past 3 or 4 years. So our longest customers, the ones that started that NIH study together, there's 3 sites that participated. All of them are still customers.
And then to be clear about the monies you've raised in the past, part of that was an NIH grant. Is that correct?
Yep.
Okay.
Yeah, the NIH grant is actually on top of our communication platform. We actually have a clinical decision support algorithm that allows surgeons to bring in an organ information and then reference that with patient data and make an organ to specific recipient risk index score on that organ or graft survival. And that is something that we've published in the Progress in Transplantation Journal. We published that study, but that algorithm is what we're expanding onto. It started with kidney. We're expanding to liver right now with a partnership with the Starzl Transplant Institute, which is led by UPMC, Pittsburgh Medical Center, that's leading that phase 2 trial.
It looks like there's a question from Steve Olenek. What are barriers to entry for your competition?
Growth. I think first mover is really important in this niche, especially with the network business, a two-sided marketplace. So really looking at those network dynamics and how we reach virality potential in the quickest, most efficient way possible. And I think the messaging is what's really sticky. So that messaging free HIPAA compliant chat tool, we really market and push that as a free tool, get people using the messaging and then upsell them to our workflow products. But I think that network effect, first one that gets the network wins. There's no direct competition in terms of a chat tool in our industry, but there's incumbents such as existing medical records and Epic Phoenix. There's a couple transplant specific ones, and also call centers who take a lot of this call volume with manual phone calls that the hospital outsources that we're offsetting with our tool. So there's incumbents and a little pushback there. And there's obviously the potential for them to try to create a tool like ours. And I think our biggest competitive barrier to entry is speed to market and growth.
And the second part of Steve's question, besides funding, what is your biggest impediment for achieving those goals?
Obviously, in a startup, you're always on the cusp of running out of money until you're not. I think we're really focused on managing expenses while simultaneously making sure that there's no opportunity cost there, and trying to find that sweet spot of growth and expense management, which is always challenging. This Wonder Fund campaign will certainly allow us to accelerate the implementation of several strategic pilots, one in which potentially could include a government contract that would really help us anchor our footprint and our product in this industry from any competitors trying to enter the marketplace.
All right. Any final thoughts, Dalton, that you want to share with everyone here?
No, it is Benefit Corp month, and so from that perspective, I'll do a shout out there. We are a Benefit Corp that goes above and beyond with extra standards, both in terms of our community, our employees, our shareholders, and our customers, to make a social impact. And regardless, if it's even if you're not able to contribute a dollar amount, you can certainly become part of our social mission by going to our Facebook page, joining our investors and supporters group, and or sharing our page with people that you think may be interested.
Fantastic. And as Dalton has here on the screen, you can find their offering page at wonderfund.co/OmniLife.